Maximizing the potential of diazepam. A closer look at the 2 mg dosage, tablets, and injections. Welcome to a comprehensive exploration of diazepam and its incredible potential when it comes to maximizing patient outcomes. In this video, we take a closer look at the 2 mg dosage, tablets, and injections of this widely prescribed medication. Diazepam, commonly known by its brand name Valium, is a benzodiazepine that has been utilized for decades to effectively manage anxiety, muscle spasms, and seizures. With its calming and sedative properties, diazepam has become an invaluable tool in the medical field. However, the specific dosage, whether it be in the form of tablets or injections, can significantly impact its efficacy and safety. Join us as we delve into the nuances of the 2 mg dosage, exploring its benefits, potential side effects, and how it can be optimized for individual patients. By understanding the intricacies of diazepam, we can unlock its full potential and provide patients with the highest quality of care. Understanding the 2 mg dosage. Diazepam is available in various dosages, with 2 mg being one of the lowest strengths. This dosage is typically prescribed for patients who require a mild to moderate sedative effect or as an initial starting point for those new to the medication. The 2 mg dosage allows for flexibility and titration, where the dose can be adjusted based on the patient's response and needs. It is important to note that the 2 mg dosage may not be suitable for all patients. Factors such as age, weight, medical history, and concurrent medications should be taken into consideration when determining the appropriate dosage. The prescribing physician should carefully evaluate the patient's condition to ensure the optimal dose of diazepam is prescribed. When starting on the 2 mg dosage, patients may need to gradually increase their dose to achieve the desired therapeutic effect. This gradual titration helps minimize the risk of adverse effects and allows the patient's body to adjust to the medication. It is essential to closely monitor patients during this titration period to ensure their safety and well-being. In conclusion, the 2 mg dosage of diazepam provides a starting point for patients who require a mild to moderate sedative effect. However, it is crucial to individualize the dosage based on the patient's specific needs and closely monitor their response to ensure optimal outcomes. Benefits and uses of diazepam tablets. Diazepam tablets, available in the 2 mg dosage, offer several benefits and can be used to address a variety of conditions. One of the primary uses of diazepam tablets is the management of anxiety disorders. Anxiety can significantly impact a person's quality of life, and diazepam can provide relief by calming the mind and reducing excessive worry. The 2 mg tablets allow for a flexible dosing regimen, enabling physicians to tailor the treatment to the individual patient. In addition to anxiety disorders, diazepam tablets can also be used to manage muscle spasms. Muscle spasms can be the result of various underlying conditions, such as multiple sclerosis or spinal cord injuries. The muscle relaxant properties of diazepam help alleviate the discomfort and pain associated with spasms, allowing patients to regain mobility and improve their overall well-being. Furthermore, diazepam tablets are commonly used in the management of seizures. The anticonvulsant properties of diazepam make it an effective option for both acute seizure management and long-term prevention. The 2 mg dosage can be particularly useful for patients who require frequent or low-dose administration. It is important to note that diazepam tablets should only be used under the guidance of a healthcare professional. The dosage and duration of treatment should be determined based on the patient's condition and response to the medication. Regular monitoring and follow-up appointments are essential to ensure the medication remains effective and safe. In conclusion, diazepam tablets in the 2 mg dosage offer several benefits and can be utilized in the management of anxiety, muscle spasms, and seizures. However, it is crucial to seek medical advice and closely monitor the patient's response to ensure optimal outcomes and minimize potential risks. Administration and dosage of diazepam injections. In addition to tablets, diazepam is also available in an injectable form, which can be administered in various settings, including hospitals, clinics, and emergency situations. Diazepam injections offer several advantages, such as rapid onset of action and the ability to bypass the digestive system, allowing for more predictable absorption and efficacy. The dosage of diazepam injections may vary depending on the patient's condition and the intended use. For acute anxiety or seizures, a single dose of 2 mg to 10 mg may be administered intravenously or intramuscularly. The dosage can be adjusted based on the patient's response, with caution taken to avoid excessive sedation or respiratory depression. It is important to note that diazepam injections should be administered by trained healthcare professionals who are familiar with the correct technique and safety precautions. Improper administration can lead to complications and adverse effects. The injection site should be carefully chosen, and the medication should be administered slowly to minimize discomfort and potential tissue damage. In emergency situations, diazepam injections can be a life-saving intervention. They can help control seizures, manage acute agitation or aggression, and provide sedation for patients undergoing invasive procedures. However, it is essential to weigh the potential benefits against the risks and consider alternative options when appropriate. In conclusion, diazepam injections offer a rapid and predictable route of administration for patients requiring immediate relief from anxiety or seizures. However, proper administration and dosage should be carefully considered to ensure patient safety and optimal outcomes. Side effects and precautions of diazepam. Like any medication, diazepam carries the risk of side effects and precautions that must be considered. It is important for healthcare professionals and patients to be aware of these potential risks to make informed decisions regarding treatment. Common side effects of diazepam include drowsiness, dizziness, and impaired coordination. These effects can impact a person's ability to drive or operate machinery, and patients should be advised to avoid such activities until they know how the medication affects them. Additionally, diazepam may cause memory impairment, especially at higher doses or with prolonged use. Patients should be counseled on the potential risks and encouraged to report any changes in their cognitive function. Serious side effects of diazepam, although less common, may include allergic reactions, difficulty breathing, severe dizziness, and hallucinations. If any of these symptoms occur, immediate medical attention should be sought. It is crucial to carefully monitor patients for any signs of an adverse reaction and discontinue the medication if necessary. Diazepam should be used with caution in certain patient populations, such as the elderly, those with liver or kidney impairment, and individuals with a history of substance abuse. These patients may be more susceptible to the sedative effects of diazepam, and dosage adjustments may be necessary to ensure their safety. Furthermore, diazepam has the potential for dependence and abuse, especially with long-term use or higher doses. Patients should be closely monitored for signs of drug-seeking behavior or misuse. The medication should be tapered off gradually when discontinuing to avoid withdrawal symptoms. In conclusion, while diazepam can provide significant benefits, it is essential to be aware of the potential side effects and precautions associated with its use. Close monitoring and patient education are key to ensuring the safe and effective use of diazepam. Comparing diazepam tablets and injections. Both diazepam tablets and injections serve specific purposes and offer unique advantages depending on the patient's needs and circumstances. Understanding the differences between these two forms of administration can help healthcare professionals make informed decisions and optimize patient outcomes. Diazepam tablets are an oral form of administration and are commonly used for long-term treatment of anxiety, muscle spasms, and seizures. They offer convenience and flexibility, allowing patients to take their medication at home without the need for healthcare supervision. The tablets also provide a gradual release of the medication, resulting in a sustained effect over time. On the other hand, diazepam injections are typically used in acute situations where rapid relief or sedation is required. In emergency settings, injections can be administered by healthcare professionals to quickly control seizures, manage acute agitation, or provide sedation for invasive procedures. The injectable form offers a fast onset of action, bypassing the digestive system and allowing for more predictable absorption. It is important to note that the choice between tablets and injections should be based on the patient's condition, severity, and individual response to the medication. Factors such as patient preference, accessibility, and the need for immediate relief should also be taken into consideration. In conclusion, diazepam tablets and injections each have their own unique advantages and are suited for different situations. Healthcare professionals should carefully evaluate the patient's needs and circumstances to determine the most appropriate form of administration. Maximizing the potential of diazepam 2 mg dosage. To maximize the potential of diazepam in the 2 mg dosage, several strategies can be employed to optimize patient outcomes and ensure safe and effective use. Firstly, individualized treatment plans should be developed for each patient. Factors such as the patient's condition, medical history, and concurrent medications should be considered to determine the appropriate dosage and duration of treatment. Regular monitoring and follow-up appointments should be scheduled to assess the patient's response and adjust the treatment plan as needed. Secondly, patient education is crucial in promoting safe and effective use of diazepam. Patients should be informed about the potential side effects, precautions, and risks associated with the medication. They should also be counseled on the importance of adhering to the prescribed dosage and avoiding alcohol or other sedating substances that can interact with diazepam. Additionally, healthcare professionals should regularly assess the patient's response to diazepam and consider alternative treatment options if necessary. Diazepam is not the only medication available for managing anxiety, muscle spasms, or seizures, and different patients may respond differently to various treatments. A comprehensive approach that takes into account the patient's overall well-being and goals of treatment can lead to more successful outcomes. In conclusion, maximizing the potential of diazepam in the 2 mg dosage requires individualized treatment plans, patient education, and regular monitoring. By tailoring the treatment to the specific needs of each patient and considering alternative options when appropriate, healthcare professionals can optimize patient outcomes and provide the highest quality of care. Tips for safe and effective use of diazepam. To ensure safe and effective use of diazepam, healthcare professionals and patients should follow these essential tips. Always take diazepam as prescribed by a healthcare professional. Do not exceed the recommended dosage or duration of treatment without consulting a physician. Inform your healthcare provider about any concurrent medications, including over-the-counter drugs and supplements, as they may interact with diazepam. Avoid alcohol and other sedating substances while taking diazepam, as they can enhance the sedative effects and increase the risk of adverse reactions. Do not abruptly stop taking diazepam without medical guidance. The medication should be gradually tapered off to minimize the risk of withdrawal symptoms. Report any unusual or severe side effects to your healthcare provider immediately. Do not hesitate to seek medical attention if you experience difficulty breathing or signs of an allergic reaction. Store diazepam in a cool, dry place away from direct sunlight and out of reach of children. Regularly attend follow-up appointments to monitor your response to diazepam and discuss any concerns or questions with your healthcare provider. By following these tips, patients can ensure the safe and effective use of diazepam, minimizing potential risks and maximizing the benefits of the medication. Diazepam alternatives and considerations. While diazepam is a widely used medication for managing anxiety, muscle spasms, and seizures, there are alternative treatment options available that may be more suitable for certain patients. For anxiety disorders, other benzodiazepines such as alprazolam or lorazepam may be considered. These medications have similar calming effects but may have different onset and duration of action. Non-benzodiazepine medications like buspirone or selective serotonin reuptake inhibitors, SSRIs, can also be used for long-term anxiety management. In the case of muscle spasms, other muscle relaxants such as baclofen or tizanidine may be prescribed. These medications work by targeting the nervous system to reduce muscle tension and spasms. For the management of seizures, other anticonvulsant medications like clonazepam or phenobarbital can be considered. These medications can effectively control seizures and may have different side effect profiles compared to diazepam. When considering alternative treatments, healthcare professionals should carefully evaluate the patient's condition, medical history, and individual response to medications. It is important to weigh the potential benefits and risks of each option to ensure the most appropriate treatment plan is chosen. In conclusion, while diazepam is a commonly prescribed medication, alternative treatment options exist for managing anxiety, muscle spasms, and seizures. Healthcare professionals should consider individual patient factors and response to medications when choosing the most suitable treatment plan. Conclusion. Diazepam, in its 2 mg dosage, tablets, and injections, offers incredible potential for managing anxiety, muscle spasms, and seizures. By understanding the nuances of this medication, healthcare professionals can optimize patient outcomes and provide the highest quality of care. The 2 mg dosage of diazepam provides a starting point for patients who require a mild to moderate sedative effect. However, it is crucial to individualize the dosage based on the patient's specific needs and closely monitor their response to ensure optimal outcomes. Diazepam tablets offer convenience and flexibility for long-term treatment of anxiety, muscle spasms, and seizures. Diazepam injections, on the other hand, provide rapid relief in acute situations and emergency settings. It is important to be aware of the potential side effects and precautions associated with diazepam. Close monitoring, patient education, and consideration of alternative treatment options are essential for maximizing the potential of diazepam and ensuring safe and effective use. By following these guidelines, healthcare professionals can unlock the full potential of diazepam and provide patients with the best possible care for their specific needs. Thanks for watching.